Good morning, everyone. I'm pleased to join you today along with Brent Roussen. Dr. Roussen, as you know, is the Chief Provincial Public Health Officer, and with Lynette Saragusa, who is the Chief Integration Officer for Shared Health, both, of course, in leadership positions on our incident command structure in the province of Manitoba. I'm Cameron Friesen, your Minister of Health, Seniors and Active Living, and we're pleased to provide additional information today on planning and preparation for COVID-19 in the province. Of course, today I will start my remarks by indicating again our sincere and unqualified thanks to all the Manitobans who are in the healthcare system, who are on the front line, who are working hard every day, who are putting patients first, who care. Thank you for your efforts. Thank you for your commitment. And also to our leadership team, to those senior leaders in the healthcare system who are leading the charge on this. Extraordinary work by an extraordinary group of people, and Manitobans can have full assurance that their interests are being fully supported and met through this hard-working group at the incident command structure and through them to their respective teams. Decisions, as you know, are being made swiftly right now. The situation is evolving very quickly in the previous days and even continuing into today. I know that at times it can feel to Manitobans that the ground is shifting underneath their feet, and we should not discount the degree of anxiety that seeing empty parking lots creates, that seeing empty restaurants and empty theaters as you pass them on the street. This is exceptional, it's unusual, and it creates anxiety. We need to acknowledge that. And what we would say to people is that while we acknowledge it, these efforts that we are undertaking are for a very important reason, and we know what that reason is: to flatten the curve on the spread of COVID-19 in our communities, and that will help us to not be overwhelmed in our healthcare system. Essentially, we are trying to push the event longer by pushing the top down. And so far we have such tremendous respect for the many Manitobans who are taking this seriously, who are taking the precautions, who are washing their hands according to the protocol, who are coughing and sneezing into their sleeve, who are not going to work when they are sick. And now in the previous days, of course, also heeding the advice of our chief to do things like limit their gatherings, stay out of crowds, to not hold play dates for their children with many children in the home. Clearly, we need compliance of Manitobans. We need their cooperation, and we need their compassion along the way as they think about the people around them as well. I want to talk about just a few ways in which the system has responded and is making progress. As of today, we have 9 community screening sites that are open, 4 in Winnipeg and then across the province, including the Brandon Regional Health Center site, which just opened yesterday. I am pleased to report that the Steinbach site will open tomorrow. It will be a drive-through site. In addition to this, we have another site opening in Winnipeg shortly, and that will be on Bison Drive. It will be at an MPI claims center, making use of that claims garage where vehicles are assessed for damage. We've taken that. It's an excellent partnership between MPI and the government, and we will have more information emerging on when that center will be open. We have other rural locations, like I told you, Thompson, Flin Flon, and the Pas, and we have more locations that will continue to roll into effect in the coming days. Other news, we want to thank Doctors Manitoba for their cooperation. Together we have been able to land on some rule changes that will offer virtual doctor visits and virtual psychotherapy options which follow social distancing requirements. Essentially what we're doing is we're taking activities that would have formerly been in person in an office, and we're allowing them to be done now by telephone or by a remote video feed. And of course, this is for not just diagnosis and treatment, but even prescription and prescription renewal. This is new, but all Manitobans can understand how important this is to help observe social distancing instructions at this point in time. We've also reached an agreement with labor unions in healthcare, which is important. It allows for staff to be redeployed and moved into areas of surge as required. It's forward planning, it is contingency planning, and I just want to cite the fact that everyone came together and put patients first in a plan that would provide certainty and ensure that staff will be there for patients. So our thanks for that success. All Manitoba healthcare facilities will be soon implementing additional precautions, and we have Lynette Saragusa here who will speak about those in a moment. They're there, of course, to protect staff, to protect patients, and to protect the community. These, of course, include the recent changes we have made to restrict visiting in long-term care centers and personal care homes. And while we understand that that does place a strain on residents and on their family and friends, we're asking for the creativity of Manitobans and the leadership of those who run those facilities to help establish other forms of contact between residents and the outside community. But we all understand the reasons for which we're undertaking those decisions. As part of our provincial efforts to ensure capacity for COVID-19, I want to state today that changes are being undertaken at the Health Sciences Centre that would allow us to move some patients into the previous Women's Pavilion. And this will allow us to have dedicated space on the Health Sciences Centre campus specific to COVID-19 patients. I want to be clear, we do not need this capacity at the current time. We are planning ahead of time. And indeed, from other jurisdictions and countries, we are learning the lessons that preparations should be made well in advance to make sure that capacity is there should it be required. These are just a few examples of how government is cooperating, collaborating, and leading to keep Manitobans safe and to respond in a rapidly changing environment. Just a few things to add to refresh the memories of Manitobans, because it's important to consider what we've done in just a short space of time. I had the opportunity this morning to speak and give remarks to the Incident Command Structure Leadership Group, and I told them it is truly remarkable what we have done as a province in a very, very short time. Some of the things we've done include our decision to sign on to a joint procurement purchase of protective equipment for hospital workers and for patients, a $35 million purchase. We were the first to sign. We are well positioned with our ventilators. We had 243 ventilators in this province. I can update you today to indicate we have just received 27 additional ventilators with more on the way. These are, as I said, unprecedented circumstances, and we're working fast. You have heard that in the retail sector, government worked with the Retail Council and with the Chambers of Commerce to be able to participate with grocery stores and pharmacy chains to be able to open for longer hours early in the day when the store is arguably cleaner, but specifically for seniors and vulnerable people with perhaps immune systems that are not as strong, so that they can also get what they need. We know that in the last week we had faculty of medicine students from the University of Manitoba helping with occupational health services, and we know that their efforts will continue. There were 10 fourth-year nursing students who started working at HealthLinks InfoSanté to help with the volumes there. I can tell you that 89 physicians have already come forward to offer their services and take on additional hours at clinics and hospitals. Our government has moved very quickly to purchase 100% alcohol-based sanitizer for healthcare facilities on a bulk purchase. And of course, you've heard about our new self-assessment tool, which is online. It is helping to divert traffic from health links and get people important information and assessment. This tool had 53,000 hits yesterday alone. It is the result of partnerships that we have formed both within healthcare system and externally with other partners. I would also say that we have been able to add interactive voice response capability to Health Links that is providing additional information to people on the line. And in addition to this, the myriad of offers of support from business, from industry, from community groups, from faith-based groups, from professionals, as well as the many indications of support from individual to individual, from neighbor to neighbor, which we know is essential in this case. I'll wrap up my remarks by saying the following. I want to tell Manitobans that while we have endeavored to provide information in a timely way and keep them up to date, because it's important, I would all ask Manitobans to use their judgment when they watch the numbers come in, because I know the numbers that we provide of the increased cases in Manitoba is a cause for concern. It creates anxiety to see those numbers rise. But I would suggest that the rise of the numbers is inevitable at this point. It is exponential as we see in other jurisdictions, but the numbers are also rising because our system is working, because we are undertaking testing, because people are working hard in the background. Our job, of course, is to make sure that as those numbers rise, people to know what to do to keep themselves safe, to keep their neighbors safe, their families safe, and people they may not even know safe. We need the compliance of Manitobans. We need their cooperation. We need acts of compassion every day. And I thank Manitobans for their excellent partnership in all of this as we face a sometimes uncertain future together. We're Manitobans. We're strong. We're capable. We're community-minded, and we will get through this. At this time, I want to go to Dr. Brent Friesen for his daily report. Brent?
Good morning. Thank you. The total number of lab-confirmed positive and presumptive positive cases in Manitoba remains at 17. That includes the 2 cases that were reported out late afternoon yesterday. Of the 17 cases, 1 individual has been hospitalized with mild symptoms. This individual is stable at this time, and we will monitor the situation closely, but will not divulge any further information about this individual at this time. As to 1 case I've mentioned yesterday, we have not yet been able to directly link this case to travel or link to a confirmed case in Manitoba, although public health investigations remain ongoing at this time. To date, more than 3,200 tests for COVID-19 have been performed at our CADM provincial lab. In order to support social distancing efforts and to reduce potential spread of the virus, day programs through community living disability services for adults with intellectual disabilities have been asked to limit this service. As soon as possible, day services will only be offered to individuals who live with family members who could lose their job if the services were not continued, are supported by home share providers who can't provide care during daytime hours and where other arrangements are not possible, and cannot be safely supported in their residence during daytime hours. Clients and their family members or care providers will receive further information as soon as possible on this. In particular, I want to remind Manitobans that now is a time for social distancing. This is not the time to go out in large groups, in crowded spaces, such as bars, restaurants, and large house parties. This is a broad recommendation, but this is in keeping with our social distancing strategies to really impact the spread of the virus in our communities. We really want to interrupt the transmission of virus in our communities, and by distancing ourselves from others is the best way to do that. Both provincially and federally, we've recommended gatherings of more than 50 people be cancelled or postponed. I encourage people to stay home and practice good social distancing for the most part. Keeping that 2 meters separation from individuals is one of our best ways to maintain this social distancing and interrupt that transmission of the virus. This does mean not arranging play dates for your children. It includes not attending gatherings outside your home, including faith-based gatherings. But remember, social distancing should not mean social isolation. ensure we're remaining connected with people, ensure we're being nice with people, and ensure that we're reaching out to the most vulnerable people in our communities. We've said it many times in the past that this is a time for action. If we haven't changed the way we're living day to day, then we haven't implemented these social distancing strategies, and we're not doing our part to reduce the spread of this virus. In saying that, we see many, many examples of Manitobans stepping up, doing their part to limit this, engaging in social distancing, changing events, postponing travel plans. These are all Manitobans contributing to all of Manitobans' health. People are starting to share credible information. And again, I remind people to go to our Manitoba government website on coronavirus. It's up to date and information for healthcare providers, for the general public, for employers, and is a great place to update yourself daily on the developments of the coronavirus. All international travelers returning to Canada must self-isolate for 14 days upon their return to Canada. I cannot emphasize the importance of this enough. Almost all the cases in Canada have been related to international travel. Certainly in Manitoba, almost all have been shown directly related to international travel. So by reducing our travel plans, by self-isolating for 14 days upon return to Canada, is our best way to protect the people around you and the public. This includes healthcare providers. Healthcare providers must self-isolate for 14 days upon their return to Canada. They must report to occupational health services. Should they be deemed to be essential workers, then we have certain processes in place to ensure our essential services remain in place. But all returning travelers who are healthcare workers must report this to their occupational health providers. I want to talk again about testing because this is an important issue. You see the lab really stepping up with the amount of tests performed. You may have seen that nationally there's been a strain on testing, and this includes Manitoba as well. We want to ensure that our tests are being utilized on individuals who actually need to be tested. So I cannot emphasize enough, people without symptoms do not need to be tested for COVID-19. Do not attend facilities for testing if you do not have symptoms. Healthcare providers should not submit samples on individuals who have presented who do not have symptoms. So I know it may be disappointing if you do end up coming to a site and you're screened and not deemed to have returned from international travel and not have symptoms. We should not be testing you. That's why we advise people to call Health Links first. You can get credible information on whether you need to be tested or not. But our lab is strained. They're going to be prioritizing samples from inpatients right now, very ill patients, healthcare workers, and as well as long-term facilities. Because of this strain, outpatient tests may show a bit of a delay over the next number of days. So again, we need to ensure only the right people are getting tested. If you have mild symptoms of respiratory illness, please stay home. Stay home until your symptoms resolve. If you have recent return from international travel, you should be self-isolating at home anyways. But if you develop symptoms, then call Health Links and they'll give you the best advice on whether to be tested or not. I know many Manitobans are worried about COVID-19 and this pandemic. It's certainly understandable. But like I said, fear and panic is contagious. Fear and panic is not going to help us against COVID-19. Our preparation, our use of credible information, and our actions right now is the time for action, will protect us against COVID-19. This is not the time for business as usual. This is the time for social distancing to make changes in our day-to-day lives. We always remind Manitobans that this situation is evolving rapidly. The pandemic worldwide and in Canada the situations are evolving right before our eyes. We often are required to make decisions without having perfect information on hand. We do our best to be out ahead of this pandemic and protect the health of Manitobans in the best manners we can. We will take any steps necessary to protect the health of Manitobans, and our social distancing strategies right now have got us out ahead of this before we have any documented community-based or sustained community-based transmission. At the end of the day, taking swift action will help protect the health of Manitobans, and we've already made a number of those measures in place. Our schools and our daycares are winding down. We'll be suspending classes at the end of the day tomorrow. Daycares will cease operations at the end of the day tomorrow with certain exceptions. So again, the healthcare system has been at its highest level of preparedness. As Manitobans, we've been preparing. We see everyone implementing these social distancing strategies. We see many, many more people going to credible sources for information, and we see many people making these actions now. And so this is we are ahead of things now in Manitoba. We're going to continue to respond to this in that proactive manner. And I thank everyone from healthcare providers to all Manitobans who have chipped in for their efforts against this pandemic. So thank you very much.
Thank you, Brent. And now to Lynette Saragusa.
Thank you. So I would like to first start off by acknowledging one of our teams that have been working extremely hard since we had our first COVID-19 diagnosis. And that is HealthLinks InfoSante. So when we started, HealthLinks was getting, they had 30 phone lines. They now have over 100. They were receiving about 350 calls a day, and now, as of yesterday, they received 2,130 calls in one day. They've had to quadruple their staffing, and they've brought in 100 nursing students and retired nurses and onboarded and educated them. They've taken over the space in every boardroom and education training room, and trying to adhere to the social distancing requirements. And I just want to acknowledge that they have made every effort possible, and I know there has been challenges with the technology, but it's not because of a lack of intent from the people. And I also wanted to say a big thank you to Ace Burpee and his team at Virgin 103, who bought dinner for the HealthLink staff with the help of his listeners, and it was really well received and such a nice gesture. It lifted their spirits, and it's just another great example of what a great province we all live in. So just to give you the rundown of the stats, so HealthLinks, as I said, they had 2,130 calls yesterday. The wait time was 1 hour and 36 minutes. We will be getting our interactive voice recording set up later today. They've been testing yesterday and today, so that will help. The self-assessment tool online, since it launched on March 17th, which was that yesterday? They had 150,000 hits to that, so hopefully that is helpful to people. And the Access Center, as the Minister has announced, Selkirk had a soft launch yesterday, so they're up and running. Steinbach is coming on board tomorrow. Brandon, Flin Flon and the Paw were earlier, Thompson. So in Steinbach, it's supposed to open tomorrow. It will be a drive-through and open 7 days a week from 9 till 3. So you can connect in there and see when the details of where. And then the other thing I just wanted to let you know is we're starting this morning. Dr. Friesen and I at our incident command approved a centralized COVID-19 contact and surveillance unit. So we will have a core team of people who are going to follow up on those contacts. They already do, but they're going to be centralized. We'll have a provincial patient registry on board and make sure that we are connected so we can follow patients throughout the trajectory, whether it's in the community, in the hospital, and be able to report that to the public health Agency of Canada and onwards. So now I just wanted to let you know, we've talked a lot about the community resources in terms of health links and access centers, but I did want to let you know that we have been, but I'm going to share some information that we are really starting to focus on building up capacity in the acute sites for when that's required. So within the next 24 hours, you're going to see that we have restricted the visitor policy for the acute sites. We're now recommending no visitors. However, we will make exceptions for individual circumstances. At Children's Hospital, one parent or guardian will be allowed in at a time. For Cancer Care Manitoba, they will look at the situation on a case-by-case basis. HSC, as the minister spoke to, they are getting ready to build up a COVID-19 medicine unit, and so communication has gone to families and patients, notifying them that we will be moving an existing unit to the Old Women's Hospital and dedicating that unit to be our COVID-19, making sure there's isolation and proper ventilation that's required there. And we've also made an ask of the chief nursing officers in every RHA to develop an inventory of critical care nurses that may have had recent experience or education and maybe isn't working in critical care, but may be accessible and available if we need help there. And I also want to say a special thank you to Doctors Manitoba. They've been supporting us in the effort to keep track of physicians who want to volunteer, and I know right now they have 89, so we're working with our medical leadership to determine where best we can put them. So that's my update, and I guess we can take questions.
À conclure, je voudrais aussi dire qu'à ce moment, nous demandons beaucoup des Manitobains. Ce n'est pas une situation normale. C'est une situation exceptionnelle. Et je voudrais dire que c'est important à ce moment pour tous les Manitobains et tous les Manitobains à suivre les règles, laver les mains, rester à la maison si tu es malade, faire des précautions, oui, et aussi sois gentil aux autres. Parce que nous sommes ici à ce moment ensemble. Et puis, on dit merci à tout le monde pour les efforts. On continue, on fait des planifications et à ce moment, on dit seulement merci. Questions for anyone?
The 30-bed, this new unit, it's an isolation unit?
They're going to make them isolation beds, yeah.
Are we going to need more staffing for that? How much staff do we need to have that in place?
Yeah, they're actually right now, we don't have any in hospital at HSC, so we will be working out the staffing, but for right now, we're looking at moving in the equipment and the supplies.
Absolutely, in plain language, when you say no visitors to acute care sites, can you define all acute care sites? Or what are acute care sites? Will there be no visitors?
All acute care sites in the province.
What are acute care sites for people who hear that message and don't know what you mean by that?
Yeah, no, that's a good question. Hospital facility based, other than personal care homes.
All hospitals will have no visitors except for kids and you said cancer care.
Correct, and there are some other exceptions as well. So they are, let me get them for you, obstetrics, neonatal intensive care, pediatric intensive care, and in an emergency or trauma situation, we would evaluate. So there's a little bit of clinical judgment, but overall, we're saying no visitors to acute care hospital facilities.
Minister Friesen, we've had a lot of people coming to us, essentially ratting people out about not following this isolation. I know we talked to Dr. Friesen yesterday. Some provinces now looking at the possibility of bringing sanctions or punishment for people that are being reckless or not following this? Is that something that we could see happen here?
It's a quickly evolving situation, and we know that people are being vigilant, but some people think that their vigilance should also include, as you say, ratting out other people who aren't following the rules, and we see some of that social shaming activity going on in online mediums as well. I think at this point we're calling for cooperation. We're calling for the judgment of Manitobans. We have not contemplated at this moment any exceptional measures, but I would say everything's on the table in terms of our ongoing response to COVID-19 because we're in it together.
What point would you consider a lockdown if, say, I guess that is the question. Like, what point would you consider maybe a full lockdown?
Are you referring to a call for a state of emergency?
Well, perhaps if that's what it would take to keep people, out of bars, out of wherever, right? Like that sort of thing.
So I'll allow Brent to answer as well, but I would simply preamble to say that we have, of course, called for some very significant measures, and we are seeing broad compliance by Manitobans. We've been impressed with the way things like restaurants and other places have responded to limit or pause activities or close their shops in the meantime. We think that this has been effective until now. However, of course, as the situation continues to evolve, all the options are on the table. We're mindful of what other provinces are doing, and I would say we are constantly sharing information with other jurisdictions, with the federal government, because we know that our response must align.
What about a state of emergency? We're the only Western province that hasn't called one yet.
It's not off the table.
What circumstances would you bring that in?
Well, I would say this, in terms of context, remember that in Ontario, they had their first case of COVID-19 in the last week of January, and then they called for a state of emergency 2 days ago. So in Manitoba, what we have said is that the things we are doing, we're doing out of an abundance of caution. We are ahead of the game in some respects of other jurisdictions. Even to this date, your chief just gave a report that indicated with 17 cases, the vast majority of these are already concluded to be travel related. So we're acting in an abundance of caution. We're bringing changes. We are having all the options on the table, but we're keeping Manitobans safe.
I don't know if it's Dr. Friesen or Lynette that can maybe answer this, but we've had a lot of readers and listeners calling in asking what they can do to help. If there's household items that maybe care homes, first responders could have that people might have at home that they could help out with. Is there anything that people can do from home that's besides staying home that might help?
Well, you know what? Let me put that out to our operations table, and I will get back to you, Brittany. That's a really good question, and those are the kind of things we want to see, people coming together and supporting each other.
At what point would we start considering testing people who do have symptoms but don't have travel history? We are opening more testing sites, so the capacity for testing is obviously getting larger.
Right, so as of right now, the capacity for testing isn't larger for us. As I stated there, the national strains through all the labs are in place. So our lab is just like that, is a bit understrained. So what we do is we'll just look at the cases. If we keep seeing a large proportion of our cases being travel related, then we need to focus on the highest risk people to ensure that we're utilizing our capacity. But as things develop, then we can expand more and more over time. But right now we're in a position where we need to focus on the most at risk to identify those cases.
Testing delays.
Are all 17 still travel related?
16 are absolutely travel related, and the one I mentioned, we cannot directly link it to travel at this point.
You mentioned delays in getting test results done. How long is it taking to process a test now and to notify positive people about it?
So it depends. So as of today, there's going to be a bit of a change. The lab is going to need to prioritize hospital-based people who are inpatients, healthcare workers, outbreaks or samples from PCHs or from First Nations are going to be the prioritized. Mildly ill people in the community, those might be delayed by a few days.
We're getting questions from mums-to-be who are pregnant right now who are worried. Anything that you can tell us about if they're more susceptible, or a mom who is almost ready to give birth right now, and things that they might need to know?
So we know that pregnant women are more susceptible to complications related to the flu, and this is various reasons for this. So I would say that they should take the precautions to heart that we're describing here, ensuring social distancing, and those that are nearing term, they should follow the advice from their practitioners on appointments and the need for those. But certainly, just like other of the higher risk individuals that we talk about, certainly those over 65, medical conditions, immune compromise, need to be extra vigilant, and the people around them need to be extra vigilant to ensure we're not spreading this virus.
When we look at these being travel related right now, there's that 2 meters before and after, so a couple rows on an airplane where people are being alerted and having to look for possible symptoms. We're hearing possibility of some transit buses right now that are being quarantined because of a possible driver who may have had this. Does that exacerbate the situation when you could have 50 people on that bus that then might need to be alerted?
Well, so all of these things are considered, and all of these are safeguarded in our social distancing strategies, right? So we realize that as more and more of the virus is introduced into our province, we're very likely going to start seeing the community-based transmission. It's tough to predict when that's going to occur, so we came out ahead of it. And so washing your hands, staying home when you're sick, keeping that social distancing, so we don't say keep social distance from sick people, we're saying keep social distancing from everyone. And so these are all built in to limit the spread of that virus, to stop that spread, even on people we might not recognize to be ill.
That might be difficult on a bus, though, when you're given a situation of...
Yeah, but the social distancing, recommendation is to limit all those type of exposures, right? So, so when you're on that bus, so remember, if this is not an airborne spread, this is spread through close contact with a sick person. So if you're sitting somewhere on that bus and the driver's 2 meters from you, 50 people on that bus are not exposed to that virus.
Media, the minister has about 5 more minutes before he has to leave.
What's the benefits of these drive-through facilities, testing facilities? And will a lot of them going forward, excuse me, be that as well?
Yeah, so I think they have a number of benefits. The one is that we're not bringing a potentially ill person inside a building and cohorting them with other people, even though precautions are taken. So that's probably the biggest benefit. We don't have to get somebody inside a building with other people.
Would it be possible to answer that in French, Minister Friesen? Is that possible?
C'est clair que ils sont c'est meilleur quelquefois pour les peuples, les gens qui pensent qu'ils sont malades, de rester à la voiture, rester dans son propre voiture. Autrement, on entre dans un centre avec les autres qui sont malades, mais aussi on continue à essayer des nouvelles choses. C'est pas exactement clair, c'est quoi la meilleure façon, et puis on continue à essayer et chaque jour on devient meilleur.
We're hearing from a lot of people who are giving up on health links, just saying, forget it, I'm on hold for 2 hours and then I get cut off. And is there anything more being done?
I disagree. I'm hearing anecdotally in the community that they appreciate the ongoing updates from the government and the ongoing efforts to strengthen that service. As I told you, we went from 35 lines to 104 lines. We've added a lot of human resources to help staff those lines. We've added the online assessment tool to divert traffic, and we've activated as well that IVR technology to help deliver that. We're keeping those times at about 2 hours. People understand it's busy, but let me take this opportunity to underscore one thing that Dr. Friesen said, which is essential. The capacity that we have for health links and the capacity that we have, especially for the community testing sites. is capacity that we must reserve for those who need it. Do not be using info links as a kind of an everyday general information line for this, that, and the other thing. We have an excellent resource at Public Health. That online tool people can read, they can find specific information. It's a compendium of information available on your device or on your computer, and we all must have a role in keeping the capacity for health links and also for the community screening sites for what they're most needed for.
Minister Friesen, has any updates been given on daycares and details to do with helping families out in that regard? A lot of people saying they're still having to pay for that spot to keep it, and a lot of parents that are worried.
There's a lot of unknowns. Clearly, we are moving quickly as other jurisdictions are moving quickly. Minister Stephenson, the Minister for Families, has undertaken just an awful lot of work with her key leadership team to be able to advance this. We felt that there was a benefit to families of providing them the advance notice of the impending closure. That was not available in all jurisdictions, and we know that many families are planning even right now. We are seeing that the volumes in both childcare and in our educational settings are declining, showing that parents are making plans. There are some unknowns clearly at this point. We're hoping to provide an update soon when it comes to childcare.
Can you provide an update for the healthcare workers that are supposed to be getting special assistance? How that's
Dr. Friesen and I and our HR lead met with the Department of Families yesterday to talk about, so letters have gone out to everyone, healthcare workers and all parents, to identify where their children are and if they have plans. So we will work with the individual sites in terms of essential workers and making sure that those children have spots. So we're letting the Department of Families take the lead, and then as we develop and see where our pressure points are, we'll connect with them on solutions.
The changes at HSC, this sounds like the first in kind of a series of moves, as mentioned. What are the other changes going to look like after this 30-bed isolation unit?
Well, we're going to start with that. And again, we don't have any acute medicine patients at this time. So it's really about staffing it up, making sure we have our processes and everything we need. So when that first patient, if and when they come, that we're ready to go. And then there are a series of other plans in the works, and I can give you more updates as they develop.
So, my interruption?
Yeah.
Minister Friesen, we had that. Sorry.
Thanks very much.
Thank you, everyone.
Mr. Sergey, just some criticism about the change on March 15th, or after March 15th, of the policy where returning healthcare workers did or didn't have to isolate for 14 days. Can you just explain the decision, the change there?
So the direction was that everyone who returned from international travel, including healthcare workers, needed to self-isolate for 14 days. There are some health workers who are deemed essential, and some of them where there's only 2 or 3 who know how to do something. And so if it was the case that we needed them in the healthcare system, it's the process is that they would call their direct supervisor. It would be approved by an executive at the hospital that this was indeed an irreplaceable essential worker. If they were asymptomatic, they could go to work with a mask and ensure that they are not in contact with our highest risk immunocompromised patients, and they would be followed by occupational health.
Is contact tracing being done for the cases that have been found presumptive or confirmed?
Absolutely. So we move on each presumptive positive test immediately, inform the case, ensure that they're self-isolating, and then immediately move to extensive contact investigation. And so each contact will be investigated, symptom review, and advised to self-isolate, followed up each day.
Does that happen with airlines? Would airlines, people that were on those flights, would they be contacted if they were international travel?
We certainly had been doing that. What we found was that international airlines, we have not seen, despite having cases on board of there, we have not seen documented transmission on there. So it was in fact a lower risk. However, when we find contacts, we advise them to self-isolate for 14 days. All international travelers need to isolate for 14 days. So whether you're on a plane or not, you need to, or if you're on that plane, whether you're a contact or not, you need to isolate for 14 days. So it's the work involved with getting that itinerary is probably more than what's needed.
Mr. So can you confirm that nursing students are testing, or screening rather, people walking to hospitals? Is that actually happening?
I can't confirm that, but I can look into it for you.
How many people showed up at the Selkirk drive-through yesterday for screening?
Heard 9. I can get back on the number for you. It wasn't a high. I think there was a small number that came and an even smaller number that got tested.
And why Selkirk?
Why Selkirk? You know what? We left that to the regional health authorities to determine where the necessary sites were based on the population need, and that was the first one that they developed.
Can you confirm anything about these quarantine buses? Do you know anything about this situation, what's going on with that?
I have not been notified of those. That was probably dealt with at the regional level if that's occurring, if it came from public health, but I have not been notified of that.
What about deeming other staff that aren't necessarily medical people as an essential service? Let's say, you know, people working at grocery stores or providing like food, water, shelter. Would you ever consider giving them that so they can get the same benefit?
Well, we're looking, we review these things all the time, and like I said, it's evolving rapidly, and we make decisions sometimes without perfect information. And when you make decisions, you're aware often of unintended consequences, but sometimes others come up. So it's the same thing with the daycares. A lot of people feel it was an obvious thing to shut down daycares, but it's obvious until you realize that it puts such a strain on your healthcare workforce and other essential services. So there's a lot of decisions going on with this. So certainly we've made exceptions to the self-isolation for people who cross the border to ensure the ongoing transport of goods and services. So truck drivers can't self-isolate each and every time they return with a load. And so these are the type of things we would look at.
Ms. Sergis, could you go into a little bit more detail about the nurses that are being asked to do more, and they've offered, forgive me, I missed part of that. Nurses that have which specific skills are volunteering to do what precisely?
Were you asking about student nurses?
Regular nurses. You had said you had identified towards the end of your address nurses that have offered
critical care.
They were critical care.
Yeah.
And 89 of them?
No, 89 physicians have identified themselves through Doctors Manitoba to be available to help support.
And how many nurses have offered to do more?
We just put out the call yesterday to the chief nursing officers to identify and get an inventory of where their critical care trained or experienced nurses are.
Are the doctors retired doctors? Is that what you said?
You know, I don't know the status. I would assume some of them are. I'm not sure of the specific details of who volunteered.
But they'd all be licensed.
Yeah, you know what? Everybody has to be licensed. Retired, yeah.
No international doctors with foreign credentials or anything?
I don't think we're bringing anyone in who isn't licensed with their colleges. Yeah, if they're here already, they might be internationally trained, but yeah.
We've been told that there's, between HSC and St. P, which have clinical rotations, one's canceled clinical rotations, the other hasn't. Why is that?
Yeah, that's a regional health authority, so that's under the WRHA. They made that decision, but we are in conversations with the University of Manitoba about student placements, their clinical rotations, and so yeah, more to come on that.
I have a specific question for Dr. Friesen. This is for a specific story, so forgive me. There's so much misinformation going around. What would your reaction be if you heard about somebody advertising an herbal tea that prevents COVID-19?
So there is no effective proven therapy for COVID-19 right now. So I would go to credible sources. I would not, take anyone up on any of these offers for prevention or cure of it.
You talked about there being a blood shortage. You said we're not in a blood crisis right now, but has there been any discussion about possibly changing or lifting some of the restrictions on blood donations so we can get more people in?
Not to my knowledge.
Of the 17 cases so far, how many are confirmed? Do you know?
So that is still coming from the national lab, and I believe that they are sent off to the national lab back in. I believe that we have 9 now that are confirmed at the lab.
Why is that 17th case, if you don't know, why is that still under investigation?
Well, because there was travel involved, but we can't necessarily link it to travel for various reasons, and so, I've been committed to transparency. So I want to come out as soon as I know that we're unable to link it yet to travel or to another case. I wanted to be transparent as soon as I could, and that may change with further investigation.
Have any been linked to each other?
These just in people who travel together.
Were any living in a personal care home or?
No.
Can you just, forgive me, I know I didn't ask, how many, because we're getting complaints from, not complaint, I mean, people are freaked out, so you can understand, they're worried, but people who've been tested haven't heard back, and you've said there are delays in testing, can you give a maximum number of days, so that?
Yeah, and I mean, this is something we fully understand, but if you look at the vast increase in amount of testing, when I mentioned that they tested 535 samples in a given day, that's 500 negative tests that have to get called out to somebody. And so that takes a long time, and I'm sure people can appreciate that we have to focus on the positives. We have to focus on the contact investigation. And there's so many moving parts right now. So I certainly understand that anxiety. Somebody's gotten tested, they're at home self-isolating and waiting. And so we're going to do what we can to try to speed that up. We have a few things in the works. So, but I hope people understand that given those sheer numbers, we have to focus on those positives and get public health in action on those right now.
But again, people need to wait until they get that positive or negative before they decide it's been 5 days. Clearly, I haven't been called, so I'm all good.
Absolutely. So if you were underwent testing, then you should be self-isolating pending a negative result. And then so I note on that the connection to what I've talked about is if you weren't having symptoms, you shouldn't have been tested. If you were asymptomatic, got tested and waiting for a negative result, you are, you're waiting probably unnecessarily, you're tested probably unnecessarily. So this is very important to be testing the right people, and 500 people who are returned international travelers who are symptomatic seems like a very high number in Manitoba for that have that many. So we are seeing unnecessary tests being done.
I don't know if you can do this in a quick manner, but just take us through what a day for you looks like.
Well, our day is really in the incident management structure. So we start off with briefings with officials, and then move into our command table section, where issues from each logistics, operations, planning, and finance bring up their issues for approval at that table. And through there, then we break into each of those tables and then meet again at the command later on to approve further things. So, and then of course, I'm involved with meetings at the FPT level with our special advisory committee as well.
This isn't a 9 to 5, like you're working.
Yeah, there's. Well, I mean, it's certainly not about me. There's probably a list a mile long of people working day and night on this, and so yeah, it's not a 9 to 5 job right now.
Quick yes or no question, did the person who was admitted to hospital for mild symptoms who was COVID-19 positive, did that person have pre-existing conditions?
I don't know.
I just have quick questions. How good are masks? Because I've heard different things about them. People say, well, they're only good for so long. When, like I look after my dad who lives at home, and I want to just know what I can do to make sure I protect my dad.
Right, so so for the general public, we're not advising the use of the masks for people who aren't ill, and that's for that very reason, is that sometimes the use of a mask, if you don't, it could make it worse if you're not using it properly. So healthcare workers certainly using it in appropriate circumstances. People who are ill being provided a mask is appropriate, but the general public, we're not advising to use masks.
If they have a cold, or they feel they have a cold, but they don't think they have, and they want to get some groceries, do they wear a mask?
My advice is to stay home if you're ill.
Okay, what about how long can the virus last on a surface?
So there's reports that it can last for many days on a surface. Those reports are finding and detecting the virus on the surface. That doesn't necessarily tell us it's infectious for that long, but we have to expect that it can be found on surfaces, it can be prolonged, so lots of hand washing.
And what about people being outside? When you say they're isolated, are they allowed to be outside?
Not in public. You know, if you're self-isolating, you should be at home. So certainly in your yard and things. But if you're not in public, no, you can walk them in your backyard, I imagine, but not in public. If you're self-isolating, you should be at home.
In your yard?
Not in public.
Somebody asked about N95 masks. Are those useful or aren't easily available? I don't know anything about what an N95 mask is. But.
Did you want to take that?
I can speak to it. So the N95 masks are a higher grade quality mask for which we, if you look at the evidence, whether it come from the World Health Organization or the Public Health Agency of Canada, Ontario, BC, Alberta, they use these N95 masks for procedures that have aerosol generating medical procedures. So if there's stuff flying in the air, the N95 would protect the healthcare worker. We don't need the N95 for regular screening, and for that we just use a surgical mask, gown and gloves, and that is, evidence would suggest that is the protection that's required. So we have a stock of both the surgical mask for the droplet and contact precautions, and we have the N95 for the aerosol.
And would those work for would the N95 work for the general public to ward against getting the coronavirus?
Well, the general public probably isn't instigating aerosol generating medical procedures, so it might be overkill for the general public. They could probably do with the surgical mask, if even that. If they're sick, they should be home. So,
what measures are you taking to ensure that inmates in prisons, remand centers, holding facilities don't transmit at close quarters?
Yeah, through our incident management structure, we're connected with each of the ministries through government, and Justice has been working on their plans for this.
Have there been any further changes to home care, the way people are going into homes or personal protective equipment?
yeah, they're continuing to work through their processes. So they're now working on a script so that home care workers can call before they enter a home and just do the screening themselves with the patient to say if they have flu symptoms, if they've traveled, and determine what the risk is and if they maybe shouldn't be going into that home. They also, all healthcare providers have been given information about personal protective equipment, and they should have that available. If they don't, they should be talking to their manager and making sure it is available. And then just like every service that we provide, we are looking at what is essential service. So that hasn't changed as of yet, but with everything, depending on where this goes, we want to just be prepared for what is essential that we must do and what are some things we can maybe put on hold or delay for a little bit. So those conversations are happening, no decisions at this point.
Anything else? All right, thanks everyone.
Thank you.
So we've